Let's talk about periods and period products. A period is when your body has started making hormones so that you could one day have a baby. If you have a female reproductive system, your period is likely to start between the ages of 8 to 14, but everyone is different. Once you've started your period, it's likely you will have them until you are much older. On average, this is around 55 years old. When your periods stop completely, this is called the menopause. You'll know you've begun your period when you bleed from your vagina for up to 7 days. Every person is unique, but usually this happens every 28 days, which is called your monthly cycle. It's common for periods to be irregular or last longer than a week, especially if you've just started having periods. It can take about a year to settle into a regular pattern. If you are experiencing very irregular, heavy or painful periods, it's a good idea to talk to your GP. Sometimes it can feel like you lose a lot of blood during your periods, and for some people, this is true. But a majority will only lose about 2 egg cups full per cycle. You may be heaviest for the first day or two, with less blood towards the end of the week. Period blood can also change colour from bright red to a bit brown, and that's normal. In between bleeding, having discharge is a good thing. It's the body's way of naturally cleaning itself, and it can look different depending on where you are in your cycle. Usually, discharge is clear, white, or cloudy. If it smells bad, changes colour, or itches, it might be an indication that you have an infection and you should see a GP. During your period, your body and mood may change slightly. It's very normal to feel a bit down and irritable. This is called PMS, or premenstrual syndrome. It's also common to feel tired when you have your period. Your body's doing lots of hard work. Make sure you get plenty of rest, eat healthily, and drink lots of water. You may have some new aches that you haven't felt before. People will call these period pains or cramps. Occasionally, you may also experience breast tenderness, tingling, or very rarely, lumps in your breasts. Remember to always check lumps with a GP. There are some medical conditions associated with having your period, but these are quite rare. Some people's mental health can be affected by their monthly cycle, feeling very down and depressed. If you notice particular pain, a lot of blood, or signs of depression making it difficult to cope with day-to-day life, you should speak with someone you trust. For most people, having a period won't affect your daily life, but you may need to consider your product choice for some sports, like wearing a tampon or period cup for swimming. Disposable pads are a popular choice of product when you first get your period. These pads are placed inside your underwear and come in different sizes and thicknesses depending on how heavy your period is. Your pad will need changing regularly to keep you comfortable. Normally, anything between 4 to 8 hours should be enough, and it's perfectly safe to wear a pad while you sleep. Pop to the toilet as soon as you wake up and wrap your used pad in toilet paper before putting it in the bin. Lots of people now choose to use a reusable product that can be washed and worn again. The most popular are reusable pads, period pants, and period cups. Everyone's choice of product and experience during their period is individual, and you should decide on what works best for you. Having a period is a perfectly normal and healthy bodily function. It isn't anything to feel shameful of. It doesn't need to be kept a secret, but it's okay if you want to keep it private. If you're ever worried, in lots of pain, or have any questions, you should speak to someone you trust. We all experience things differently, so it's good to get advice on how people can help. For more information and advice, take a look at our website